includes the next item, which is the COVID-19 briefing and the Auckland Emergency Management Status Update. Can I just check that who I have on the line? I should have Ian Maxwell. Are you there, Ian?
Yes, I am.
And Mace Ward?
Yes, I'm here, Your Worship.
And Kate Crawford?
So Kate is not on the line.
Thank you.
So Mace is answering that.
Okay, and Roger Murphy from Auckland Transport. I think you're doing a quick presentation for us, Roger. Are you on the line?
I am, Mr. Mayor, yes.
And our recovery manager, Phil Wilson. Phil, are you there? Okay. Normally he'd be in this room. We worked him very hard yesterday. He's probably still recovering. Okay, Ian, if I can ask you to lead off, followed by Mace, and then we'll have the presentation by Auckland Transport, and then we'll go through the roll call again on questions and comments.
Okay.
Thank you, Ian.
Okay, look.
We got one word in there from Ian, and he disappeared.
Can you hear me now?
I can hear you. Are a little bit echoey, but give it a go.
All right. Look, thank you. So look, I'll actually ask Mace to commence with the controller's role, and then I'll talk briefly through what we're doing with respect to the council, and then we'll ask Roger to come and talk about where Auckland Transport is at, and we'll finish off with Phil Wilson. So Mace.
Thank you, Ian, and good afternoon, Your Worship and councillors. So, appreciate the opportunity to provide this update. The nationwide state of national emergencies, as you will probably know, has extended for a further 7 days until Wednesday, the 13th of May, and we remain in alert level 3 or restrict, with a decision by Cabinet to whether we will move to alert level 2 on Thursday, the 7th of May. And of course, there are some announcements today by the Prime Minister on what alert level 2 could look like. Today, I'm obviously supported by Ian, and Roger will give an update. Roger Murphy will give an update on Auckland Transport Network operations. The Emergency Coordination Centre in Bledisloe House remains active, with people across Auckland Emergency Management and the Council working together with representative agencies from other response agencies across the region. So that's on level 1. And level 9, we have the Regional Isolation and Quarantine Coordination Cell looking after guests who have returned to the country as New Zealanders. And also a multi-agency approach in that cell. In terms of our Caring for Communities function, our main focus of the emergency management response continues to be focused on non-health related welfare needs of Aucklanders across the region. Our welfare food parcel initiative, in addition to the significant initiative by community organisations delivering food and welfare, has been running for 5 weeks now, and we've taken just over 32,000 phone calls from Aucklanders in our Auckland Contact Centre, which has resulted in more than 16,000 requests for assistance. Other requests that we've received have been redirected to the long-term community-based support services and other welfare support services such as the Ministry of Social Development. As of the 5th of May, as of the 6th of May, yesterday, at Wednesday, we had dispatched 26,000 packages as part of those 16,000 requests and supported around 12,300 households. And of the packages, around 20,000 were food packages and 6,000 were smaller custom pick boxes of essential items that people required. As last week I mentioned that we did have a backlog of deliveries. Whilst I'm pleased to say that there is no longer a significant delay in delivering boxes, we continue to work through and ensure that people get their essential supplies in the shortest order we can possibly deliver those supplies. The supply chain has now been freed up, and we are projecting what the demand will be over the next 2 to 3 weeks. But we have good supplies of essential items for people. Call volumes, I should say, are falling off a little, but as we know, some of the subsidies, central government subsidies, will come off in a few weeks, and so we're keeping an eye on that and what the call volumes do and what's happening in the community. We certainly, I just acknowledge again the unprecedented situation we find ourselves in with our community with COVID-19, and that has put pressure on our communities. And the demand that we're seeing is consistent with deprivation areas across Tamaki Makaurau. But I'm very pleased to say that we're meeting that demand along with community partners. In terms of the Regional Isolation and Quarantine Coordination Cell, that is operating on a 7-day-a-week basis with our partners, including Ministry of Health, New Zealand Defence Force, police, airport agencies and other government departments. So at present we have 2,505 people in managed isolation and 148 in quarantine hotels across Auckland. And that number continues to change, as you'd appreciate, daily as people reach their 14-day anniversaries and can return home as new flights arrive. We have provided some significant support in terms of navigators within the hotels so that people get receive welfare needs, and some of those needs have been significant for people suffering from this event. So far, we've had 285 referrals for welfare support for guests in the quarantine and managed isolation hotels, and that includes particularly psychosocial support for people in those facilities. In addition, over 48,000 foreign nationals have now been managed through Auckland Airport and left New Zealand to return to their home countries. So significant amount of work in seeing those people get back to their home countries. Our function around Te Pou Whakarai with Māori, looking after Māori communities, continues its outreach program to marae, iwi and mātāwaka organisations, as well as continuing to provide staff to assist our partner welfare organisations such as MSD in contacting vulnerable Māori clients. So 750 phone calls have been made to vulnerable Māori clients to perform welfare checks and provide advice and assistance to those people. Since the last update, we have noted there's been an evolution of the support being requested by marae and community support groups, as well as food support. The assistance providing heating support in the form of firewood and other warmth has been requested, and we've responded to those requests and they've been managed on a case-by-case basis. A program of regular antiviral cleaning has been established across 4 marae which are acting as distribution centres for emergency supplies and health checks, and including those health checks, including providing facilities for COVID-19 testing. So we're supporting that hygiene work. Requests for assistance for burials at Urapa have also been received, and we're providing support to ensure that happens in a safe and orderly way, supporting those marae who have urapa. As of yesterday, 1,422 food parcels and hygiene packs have been delivered to whānau on behalf of marae through the marae that are working as distribution centres, and cleaning and sanitation packs have been delivered to 13 other marae for that are providing other essential community services. Lastly, we've distributed over 50,000 bilingual flyers to increase awareness of COVID-19 in communities that perhaps don't have the normal social access to normal social media channels. Just a note on general coordination, and I know Roger will cover this off for Auckland Transport, but there's been significant activity to put in place and adjust traffic management plans near high-risk sites. I'll let Roger take you through that. And lastly, Your Worship, I'd just like to thank you and elected members and IMSB members for your leadership and support for the Emergency Operations Centre, and also the people across our CCOs, Auckland Council staff, and our partner agencies who are helping us contribute to responding to this to COVID-19 event in Tamaki. Thank you very much.
All right, thank you.
Come back to Ian.
Look, thank you. I'll now focus on Auckland Council. And so, look, there have been no further COVID cases either within Council or the CCOs. The move to level 3 by Council and the CCOs has really been largely without incident. Today, within the Council, we have some 620-odd people back at work in their normal workplaces. So these are delivering essential services and also a range of field staff. And those who are in offices are tending to be rotating through those offices so that there's relatively few numbers at any particular time. Our construction and maintenance projects have largely recommenced. That took a little time to get the folk on the ground trained up in the new sort of social distancing and COVID-related health and safety requirements. And you would have seen the announcement yesterday around the recommencing or resuming of paper recycling. So a little way to go with plastics yet, but paper recycling is back. This afternoon, I think in about an hour or so, the government will announce the nature of what level 2 will be like. And next week there will be a decision from government about when the country will move into level 2. So the move to level 2 will be a significant change from what we've had with levels 3 and level 4, and that will be a change both for our city, our region, but also for our council and our CCOs. For council, many more of our people will be able to return to work, but we shall not be returning to the way it was prior to COVID, prior to the emergency. We'll be moving to this this concept I'm sure you've heard of a new normal, and I'll just run through a little bit about what that could be like. A significant proportion of our workforce will remain on any particular day. They will remain working at home, and I'll run through why that's the case. A proportion of our people will be unable to attend work. So people who might be, because of their age or perhaps because of pre-existing health conditions, people who are especially vulnerable to COVID will need to remain at home. And we've done some work in this area. So some teams and some departments have estimated that this number could be as high as 15%. We don't have that. We don't know all of those people yet, but there'll be work done over the next sort of week or 10 days to identify those folk. We also have a need to continue to support the Civil Defence Emergency Management role. And look, it's expected that our Emergency Coordination Centre will continue to operate at a high level for some weeks and possibly months ahead. And some elements of the work that Mace talked about could actually run right through not just level 2, but potentially into the alert level 1 as well. And in addition to that, we'll need to staff a recovery operation. So Phil Wilson will talk shortly about the beginnings of and the thinking that's going on around what the recovery operation may look like. And to be fair, there's still a lot of work to go in that thinking. We're looking for direction from central government, and that's not expected until next week. But we do know there are likely to be implications for us as council and us as staff in terms of resourcing that. Most importantly, in level 2, we do need to maintain social distancing. And that's going to limit the numbers of people who can return to their normal place of work. In short, we're not going to be able to fill up our workspaces to the level that we probably did before COVID-19. So given these social distancing requirements, we expect that if you look at a particular room or you look at a particular office space, we really are only going to be able to utilise perhaps 50% of that capacity for the period of level 2. So that's another reason why returning to work in a new normal, that new normal will be a more spread out normal for our people, and indeed for elected members as they attend meetings. So in summary then, Auckland Council will not have their normal level of staff available for business as usual, and we're looking at what that means in terms of a staged approach to reopening services and getting back to business as usual. And you'll be aware there is also the issue around the financial situation of Council has changed, and it's changed significantly as a result of the pandemic. Unlike local councils elsewhere in New Zealand, a significant proportion of Auckland Council's revenue is earned from non-rate sources, revenue from dividends, user charges, fuel taxes, development contributions, those sorts of things. So the revenue from those is much greater for Auckland Council compared to other councils around the country. So the pandemic has impacted those revenue flows, and you'll be aware from the workshops you've undertaken that our incomes have been reduced significantly over the next 12 months. So that has meant the development in our emergency budget, some thinking around the nature of the services and so forth. On top of that, we also are unaware how people will react in level 2 or indeed level 1. How many people will come on the buses? How many people will come to some of the services we may reopen? So those are uncertainties we have yet to deal with, but we do know that it's likely to impact on expected revenue sources. So those are being worked through now, and I know workshops have been held with yourselves and local board chairs, and more information around the implications of that will be recommended through to you over the next week or two. So look, if I can pass over to Roger, and Roger can talk through where Auckland Transport is at in terms of how it's responding to the COVID issues. So Roger.
Thank you, Ian. Good afternoon, councillors. I'm going to take you through some slides here that are up on screen, and I'll get Sandra to flick the slides through as we go through it. The slides are going to focus on, there's a dashboard that I'll walk you through first, which covers some of the points that Ian has already talked about, some comment on our people, and then just some comment on our work stream initiatives. Our crisis management team is split into 8 work streams, and in particular I'm going to be talking a little bit about the road network, public transport, construction delivery, and our communications. So Sandra, I'll get you to go through to the next slide, beyond the agenda slide, which is the dashboard. Thank you. So just on this dashboard, I'll just comment on some things in here. We put in place an average, like a daily pulse score for our all of our staff, all of our team, to ask them how they were feeling as they were working from home, given all of the different things that work from home requirements have. And that's a score of 1 to 5, and 5 being at the end of the scale that says I'm feeling really great, and whatever description that may be. You can see that the average there is, our last week is 3.45. It's fair to say that people are probably getting a little frustrated on different things. We're hearing different anecdotal comments on that, and that wouldn't be any different to anywhere else. But it's still pretty high. So we're quite encouraged by that. We have several hundred people a week clicking on to that. The next part of that on the left-hand side is under logistics, and that's just talking about the people that have access to our buildings. So on a weekly basis, you can see that in the 2 weeks prior to last week, we had roughly about 120 people coming into our buildings per week. We've got a number of people that are coming in to go out onto the network to do different things like traffic management and so forth. But last week we did have a spike. We had 346 people come in, all of them under an authorised situation. The bulk of that spike related to the fact that we were bringing people in for flu jabs. So we've got a program underway at the moment to deliver those flu jabs for our people, and we're expecting that to continue into the next couple of weeks. You can also see that we've got a number of organisations where we've issued authorisation cards as essential service providers, as we have with a number of our own people. In the construction delivery area, that's the bottom left-hand corner of this slide, we have a number of active sites. So we closed down 160 construction sites, and we've just reopened those as we went into Alert Level 3. And that had different requirements on it, and they required health and safety plans, but just not your normal health and safety plan. They had to have COVID-19 related components in those plans around physical distancing. To give you an example, the downtown construction site area has 190 workers with 29 different bubbles in it that have to be managed. In that period of time, we, in Level 4 and into Level 3, we've done 320 inspections, just making sure those sites are still okay, and we had picked up about 9 incidents, and that would range from vandalism to fences being moved and so forth. It's important to point that health and safety plan out because there are PCBU obligations for us in there, and we need to adhere to those things. I'll go to the top right, which is on public transport. At the start of Level 4, we had dropped to around about 12,000 trips per day, and that was at around 10 or 11,000 at the weekend. That towards the end of Level 4 had gone up to around about 18 to 20,000 trips a day, and our current numbers are running at 37,000 trips per day and increasing. So you can see that our current level as of last week, which picks up 3 or 4 days of Level 3, we've gradually increased. We started at a loss in terms of our patronage of 96%, and that's now down to 89% and reducing, which will be good as we go into Level 3. We are seeing a high level of, just in the last few days, of antisocial behaviour on our network. We've had a train tag this week that we have to respond to and obviously get cleared up. But what we are seeing too is we're running 3 surveys. We're leveraging off a Colmar Bronton survey that surveys 1,000 people a week. We've got our own AT customer survey at 300 people a week, and we've got more specific targeted surveys. The satisfaction tracker that is running at 84% as of Anzac weekend of people who are travelling on PT during lockdown believe that AT is effectively managing the risks, which is good to see, and it's quite high obviously, so we're quite pleased with that. You see the customer survey responses there in terms of how we're managing those risks. They're sitting at that 63 to 61% last week. Again, that's pretty encouraging in terms of those kinds of results coming through. And I'll talk a little bit in a minute about some of the perceptions out there from our customers around their health concerns and public transport. You can see the total call centre coming into our call centre. For us, that's starting to increase, which is good because call volumes are picking up as people start to think about what they're going to do when we go to Alert Level 2. And you can see our response time is running at about 10 or 11 seconds in there on average. The supplier support area, we are doing a number of areas of work around cost savings and also looking at our contracts and looking at our professional services spend in order to see what savings we can make there. I'll move over to the people slide. And this is just to pick up something similar to what Ian was talking about. From an AT point of view, we were tracking a total of 117 people who had self-isolated as a result of either travel, contact or being vulnerable. And in that 117, we also had 1 confirmed case of COVID-19. That number now, it's on the slide there, is saying 7 as of this morning. That number is now 1 person is now in self-isolation. All others have returned to work, including the confirmed case who has fully recovered and is back at work. So good news from that point of view. We In terms of test results that we've had coming through here, we did have 18 people that went through COVID-19 testing, and again, we've only got one pending result. There was one confirmed, as I've said. There's been quite a lot of proactive support to our construction delivery area from our health and safety team as well, to make sure that that's working well, and we've had quite a positive response to the people initiatives that we took to the wider organisation last week around remuneration reductions and salary holding at the end of the year. I'll move on to the next slide, please. And look, I'm not going to read every one of these bullet points, obviously, but this is just to give you a sense of the workstream activities that we have sitting behind this. We have a lot more detail, but I'll talk to a couple of areas in here under each workstream. The parking officer deployment area is going well, with quite a lot of positive feedback as we've redeployed our parking officers to help manage at areas like hospitals, traffic management, at testing centres, also at fast food centres or fast food locations and other targeted locations, so that we can help with traffic management and help police. We have had some incidents with our transport officers and other officers out there with a member of the public spitting at our officers. We've had 3 that we've had to put into self-isolation and get tested, and we had 1 on a train just the other day, but they were far enough away that we didn't need to take any further action. Police are involved in all of those things. Not a pleasant part of the process, but it does bring some context to what we're dealing with. In terms of other things, this work stream, the road networks area, has been obviously quite involved in some of the interventions that we've put in place around pop-up cycleways, around widening of footpaths, management of intersections and traffic signals and so forth, to try to help facilitate safety and physical distancing. And the key thing around that is saying that we need to be agile. We're trialling these things. We may not get them all right. We have had some feedback on some of these that we've responded to, so that we can make some changes. But we are very much focused on safety and social distancing and trying to facilitate that for Aucklanders. In terms of that logistics area, interesting thing in there is that we've got some apps now in place and some technology in place in our building, main building especially, where people no longer have to use a kiosk to come in and sign in. When they do eventually come back to the building, we've got that can be done by phone, and we can track those phones throughout the building, including our big meeting rooms, where they will scan a barcode so we know how many people are in a room and track those later on if we needed to. So some good technology developments that are going on there. We have got a number of areas of signage around physical distancing, whether they're decals on pavements, different signage and so forth. We're changing those from the level 2 requirement to the level 1 requirement to the level 2 requirement of 1 metre as we go from 3 to 2 in the little while in the next couple of weeks. Just in terms of public transport, I've commented on the 37,000 trips a day. Just to give you a feel though for what that means for us, we've been continuing the normal weekly timetable for level 3. We anticipate that if we run at the 2 metre distancing, that allows us to utilise 22% of capacity on a bus, for example. So that does leave quite a lot. If we're going to a 1 metre physical separation, then we think that can get up to 43%. That's the equivalent, in terms of the comparison to the numbers, of going to 150,000 people a day. There's still discussions underway with the Ministry of Transport and the NZTA on getting a firmed up national view and agreeing on that as we look to go into level 2. One of the areas that we're trying to get better clarity on is what's happening with the schools, because we've got a number of school routes that we're looking after. At the moment, there are very low numbers of students on the buses going to schools. The trains are continuing on the Sunday timetable in level 3, and we have put on other trains, for example, to Middlemore to help Middlemore staff get to their 7 a.m. shift, and we've put on a number of other train services as well to make sure that we can deliver on the 20-minute frequency of train services in comparison to a level 4 timetable, which was a reduced timetable. I'll move over to the next slide, and that's in the construction delivery area. I've commented quite a bit on this already, which is around the review of all the health and safety plans that we went through on that, and then testing that. Those have been done in conjunction with WorkSafe. We had WorkSafe come and have a look at what we were doing, and so we're aligned to all of those government requirements, and very focused on those with the number of inspections that we've got underway there. The advance entitlement payments have been continued to be processed. We've had 16 received from 14 suppliers. That's totaling about 5 million, and a good number of those have been processed as of the start of this month. In the supplier support area, there's a few things going on there. Just the regular communications and targeted communications with our suppliers. So our CE, Shane, has been in touch with our key suppliers, just keeping them up to date with what we've been doing, and particularly our operators. We're sharing a lot of what we're doing with our operators because not all of them are resourced up to be able to deal with a situation like this, so we're sharing those things with those operators so that they can put similar things in place. In terms of the supply chain risk, the key issue that we've had to deal with is the EMU delay. Otherwise, there are not a lot of issues coming out of that yet, but we're staying in close contact with other agencies, with Council, with NZTA, and so on. And just to give you a feel for the number of masks that we're having to manage, we took delivery of about 80,000 masks in the last couple of weeks, 60,000 last week. We're using around 10,000 masks a week that we're providing out to our operators to help them do the things that they have to do and have some level of protection. The issue of having masks on public transport, the intelligence that we have on that is, to give you a global perspective, first of all, there's around about 50 countries globally that have mandated the wearing of masks in public, including public transport, and there's about 30 countries that are saying that's a personal choice. So we are continuing to work with the Ministry of Health, the Ministry of Transport and NZTA on making sure that we are staying across that in terms of what that might look like going forward. On the customer front, just off the back of the surveying that we've been doing, we've got some feedback in there which is essentially saying that we're seeing an increase in the number of people claiming that they would accept the risk of the virus and go back to work tomorrow if they were allowed to. That's heading towards 40%, and that's up on last week. But there's still a majority that remain nervous about leaving their homes. 61% of Aucklanders do feel that public transport providers are taking effective measures to limit the spread of COVID-19, and this was through the Colmar poll. That's considerably higher than most people who have been travelling on the network over the lockdown period, which is 84%. So some good feedback on that, which is good. But we do have 55% of customers that are concerned about that Auckland Transport may not be able to maintain social distancing as capacity pressures increase and we move to alert level 2. And we've got a lot of work underway to accommodate that. We are in a lot of detailed preparation for the level 2 announcement, printing stickers and footpath decals and posters and so forth to go to the 1 metre physical distancing. And the customer messaging is around installing confidence with the public and that it's safe to use public transport, and trying to show them that we're facilitating that physical distancing, but also encouraging the spreading of peak travel and showing them that we're creating seat availability by doing things like that. There are some other things that we're doing that I've spoken about earlier around pop-up cycleways and so forth. And just in terms of the last slide there, or not the last slide, there's a couple of others after that I'll only touch on briefly. The communications area is very central to what we're doing, and that's focusing very much on giving people confidence out there, and I include our stakeholders and elected members here, and meeting with those and giving you the necessary communications that gives you some insight into what we're doing. And the latest one that's coming out to elected members is coming out from our CE tomorrow afternoon. We are focused on staff wellbeing and making sure that we've got good communications in place. And there are a large number of localised consultations in terms of different projects and work initiatives that were paused during levels 3 and 4, and they're likely to restart under level 2. We are getting good feedback from the media on the media updates that we're providing, but it is important that we're aware of things as they happen, any changes, any actions that we need to do. And we've had a learning in the process of needing to inform elected members a little earlier if we can, 1 to 2 days before some of the things that we're needing to do, bearing in mind that we're having to be agile as we go through this. Just the last 2 slides I won't comment on in any great detail here. Thank you, Sandra. Is just to show that we've looked at the move from level 3 to level 2, around the impact, first of all, under each of the work streams, and you can see that we've got a transition of our workforce. We're going to gradually bring that back up to 25% and then 50%. You can see the impact with a higher network activity, both in terms of public transport and vehicles on the road network, and the seat capacity and demand estimate that we have to deal with as we go from 2 metre physical distancing to 1 metre physical distancing, and some of the comms and signage that we're doing there. And the last slide there, thank you, Sandra, is just showing some of the preparations for level 2, just making sure we've got a rotational system for our employees coming back into the office. In terms of logistics, we've got fixed desk allocations, we've got a new technology and so forth in place to deal with that. In terms of the road networks operations, there's a lot of messaging going on around that and trying to look at peak spreading. As we have put in place some interventions in the last couple of weeks, then as we do go to level 2, we will have a number of our people out there physically watching, along with our contractors, watching what is going on, including our ELT and our group manager level, to make sure that we're on the spot and can move quickly in an agile way to reduce things. So, for example, if we needed to, we could remove a pop-up cycleway if that's causing an issue at a pinch point, or we could remove some widening if we see the pedestrians reducing and the vehicles increasing. So it's a very agile situation that we're going to be getting ready for. I will stop at that point and see if there are any questions.
Thank you very much. Before we take questions from anybody, I think we'll hear from Phil Wilson on recovery. I then intend to run through the list for questions and comments, and as soon as we've finished this item, we'll break for lunch. That's an incentive for all of us to be precise. Okay, Phil Wilson, thank you.
Thanks, Your Worship. I'll move fairly quickly. I have 4 slides only. I'm not going to cover every point. So, councillors and Mayor, we're still in a reasonably fluid and fast-moving situation, and some of what I'm going to talk about reflects that. The starting point at the moment is that we take guidance from the Civil Defence Emergency Management Act, which sets out certain responsibilities, and you're well familiar now with the function of the controller, Kate and Mace, in that regard. We are looking at a transition process from this response phase into recovery activity, and with that will come a moving of some responsibility outside of the Civil Defence Emergency Management machinery into activity directed by the Council and other agencies. What's needed is good planning around that. To help that, we're expecting guidance from the National Agency next week. In truth, it's likely to be a bit iterative over the next few weeks in terms of clarity from central government about what the expectation is. It will talk to a number of matters, we expect, if you like, the balance of the national imperative, what's required nationally, versus something more regional, and the language that's being used in this regard is that it's likely to be nationally supported but regionally led, and that gives you a sense of what role or responsibility we might have going forward in the recovery space. More particularly, you know, who's needing to be involved, what's required, how it's going to work, and some stuff about funding responsibility, I would anticipate, or possibly more correctly, where costs are expected to fall. It'll also, because we need to monitor aspects of this at a national level and be consistent, there'll probably also be direction, some expectations around measurement, monitoring and reporting. I'll just go to the next slide. Would make the point that if you look at it through a purely civil defence emergency management lens, you possibly get one perspective on what recovery looks like, but of course Council's interest is likely to be broader than that and directed to some degree by what we're seeing in our communities and what communities are expressing to us in terms of need, and of course what you as regional leaders would seek to do in terms of leadership and resourcing of some of the downstream issues that we're likely to experience with employment and business regeneration and so forth. Simple point that Council is one player. There are many others, other agencies, there is community effort, NGOs, community organisations, very significantly an iwi perspective on this, and the role of marae and structures within Māoridom. Likewise, our CCOs are part of this. My simple point is that we need to aim for an inclusive overarching plan that a number of interests can buy into. We have done some, I won't go into detail, we've done some work on the framework for that already. It, as you would expect, needs to cover off how things are coordinated, what activity is to be undertaken, how we communicate effectively and give the community confidence that A, there is a plan, B, that it takes their interests into account properly, and that we've got some initiatives sitting underneath this that are well organised, resourced and in time delivered. As much as we need to wait for some direction from central government, we've taken the view that we can't simply wait and do nothing until that arrives. So we're underway. We've got a core planning team together, and we're doing activities such as stakeholder mapping, who needs to be involved, and so on. Look, there are a number of concerns, just to quickly register, and we're getting ahead of these every day, but clearly there's some frustration waiting for the direction. There's an absolute need to involve others in the planning for recovery activity. It should and will be a collaborative effort involving other players. But clearly we don't have the luxury of a very long time frame to actually get some sensible planning done. So there's a sense of urgency there. We need to be taking action rather than spending months developing an immaculate plan. It needs coordination. We need different agencies to be on board with this, and the discussions with Wellington suggest a role for us and others in achieving that coordination. I think I will probably leave it there. The others items speak for themselves, Your Worship.
Thank you very much, Phil, for that, and thank you for all of our presenters on this item, Ian, Mace and Roger. Look, let's try to keep this relatively brief if we can. I'll go through the roll list in reverse order this time. Combination comments and questions. Can you please limit your questions to one, the most important question you have, and make your comments as precise as possible. So we'll start with Councillor Paul Young. Paul, any comments or questions?
No comment. Thank you, Mr. Mayor.
Thank you very much. Councillor John Watson.
Thank you, Mr. Mayor. No question, but one very quick piece of feedback by way of comment, and that goes to Auckland Transport's social distancing measures that have been employed, and this is on behalf of local board members, 2 ward councillors and the community at large, and that goes to what has occurred on Otiha Valley Road, which is the busiest arterial in the Albany ward, serves the northern motorway in the Albany Mall and the Albany Township. Auckland Transport, on the guise of social distancing, closed 2 lanes of traffic 2 weeks ago, initially along the entire part of the road, including the western half of Otiha Valley Road, which already has 2 walkways, cycleways on one side and a footpath on another side, and in which, in the time I was there, I saw 1 person using the pop-up cycle lane. That was in an hour and a half, and a handful of pedestrians. On the flip side, the effects on the traffic congestion there have been significant. So, and that includes for essential workers trying to get a number of the elderly people who live in the rest homes along there to hospital appointments. That's been disrupted. The traffic's been backed right back. There's been road rage. There's been near misses with the rather inadequate merging system. So all in all, Mr. Mayor, it has not been a success. Auckland Transport did concede and withdraw the 2 lanes on the western side, but left them on the eastern side, where paradoxically enough we have the busiest flows of traffic and where the problems that I outlined to you contain. So I know it's a time of esprit de corps and all the rest of it, but I would just say that the effects on our community have been significant. It's catered for a handful of people. There is adequate room for social distancing on the eastern half as it stands. There is 2 metres there. I've been along there and walked along there myself. But what I'm concerned about is the increasing and unnecessary stress being caused on the community and some of the, the behavioural responses of traffic. I didn't see any Auckland Transport officials there looking last night. There was one gentleman from a private firm, I understand, doing a count on the cyclists and pedestrians. So his pencil wouldn't have been worn out too much because there's only a couple of people, very small numbers of people going along. So I would just say finally that this has not been a sensible or pragmatic intervention. It has been totally unnecessary for half the road. It's caused congestion and angst, and I sincerely hope that it's removed as quickly as possible under level 2, because the pleas or the treatises from board members and councillors alike have not been responded to in an adequate fashion. So yes, there are plenty of places in the city where it's worked. The busiest arterial in a suburban road, a suburban district accessing the northern motorway, is not the place to take out 50% of the road capacity, even under level 3. Thank you.
Thank you, Councillor. Roger, can I throw that one to you? One to respond to Councillor Watson's comments, and just to check, have you re-examined the propriety and necessity for that particular area to have had the changes that you've made to them? Roger.
Thank you, Mr. Mayor. Yes, we did have a look at that, and as Councillor Watson mentioned, we did make some changes on one side and reduce the amount of intervention that we had put in place there. What we are trying to focus on here is around safety primarily and social distancing, and I accept Councillor Watson's comments. In terms of the total picture here, we've put in place 104 different interventions covering different parts of the city. And look, some of these we may not get right. We're trying to get as many of these right, obviously, as possible, but we are also being as responsive as we can if we haven't quite got them targeted in the right way. Councillor Watson, I'm more than happy to ensure that we follow up offline with you on your concerns as well, if that would be helpful.
I think that would be helpful. I think, you know, look, yeah, you won't get them right all the time, but the important thing is if you haven't got something right is to set it right. That might be a case that I'm not familiar with the need for it, but I think some dialogue between yourself, Roger, and John Watson and Wayne Walker would be helpful in this instance. Thank you very much, Councillor Watson. Councillor Walker.
I'll be very quick. I just want to completely emphasise again the comments that John Watson made, and to emphasise that the present circumstance with the cones is actually unsafe for motorists. I'll repeat that, unsafe. It's also unsafe for cyclists. I've seen that for my very eyes. It's expensive, it's impractical, it's hazardous, and it's not used, and it needs to be removed immediately. And certainly I've indicated in an email that I'm happy to meet on site and point all of these things out, and both John Watson and I have suggested pragmatic options around improving the existing footpaths and cycleways that, frankly, if you're going to spend money, that's what you do.
Thank you. Look, a very clear message from two councillors there, Roger. If you guys can get together and sort out the need and the propriety of having that in place there, I think that would advance the case. That we should have an idea of the number of people using it, the need for it, as against the difficulties created by it. So I'll leave it to the two councillors and Roger Murphy to work that one through. IMSB Chair, David Taipere.
Nothing from me, Your Worship. Thanks.
Thank you. Councillor Sharon Stewart.
No, I'm fine, but I do agree with Councillor Walker and Councillor Watson. Thank you.
Thank you. Councillor Desley Simpson.
Thanks, Your Worship. Roger, look, thank you very much for your presentation. I've just got one question just for you, and I just want to say something positive. I have seen, as a result of a query I put through, your reaction, or Auckland Transport's reaction, I should say, to changing work along Tamaki Drive pretty quickly, so I really want to say thanks for that. Look, my question is around the fact that, as you know, my ward is very close to the city, so when the public transport is coming back, the buses may well be full. Have you got a how full is your bus app, or how are people going to have confidence that when they get closer to the city and they're the last people on and the buses are often full, that there will be room for them to access public transport to abide by social distancing? Thank you.
Roger.
Thank you, Councillor Simpson. The answer to that is yes. We've developed or we've expanded the options on one of our apps, AT Mobile, that allows people to go onto that app if they've got a bus that's 500 metres away or a kilometre away, and that will tell them how many people are on the bus and whether it's safe for them to get on that bus, and the same for trains as well. So yes, we've done something along those lines. That might mean that if people see that, then they can wait for the next bus as we go into the full schedule of our bus services as well, of course. One thing we will be doing with our schedule, though, is to check where we've got those heavier loaded areas where buses may be experiencing higher loadings than we would like, and we've got the ability to respond to that to a point in terms of putting other services on as well.
Thank you.
Thank you, and congratulations on that app. It's innovative, it's world-beating, it's really good. Councillor Greg Sayers.
Thank you, Mr. Mayor. Just a quick question, Roger, regarding the Hibiscus Coast bus terminal there. Is that under level 3? Has work commenced on that, or will it commence under level 2? Just a quick update there would be appreciated.
Councillor Sayers, I couldn't give you a firm answer to that, other than all of our construction sites are up and running. If we were planning on recommencing there this last week, then the answer would be yes, but I would have to go back to my team, so I can follow up on that offline if that would be helpful.
Yes, they are, Roger. They are working there.
Thank you.
We got an answer already. Thank you, Councillor Watson. Councillor Newman.
No, thank you.
Councillor Mulholland.
No, thanks, Your Worship.
Councillor Hills.
Whoops, sorry. Thank you very much for all the work that's been done. I really do have concerns about if we start taking away the social distancing things too early, or we don't ensure safe passage on the roads. Somewhere like Otia Valley then might need some emergency work to actually build cycleways. There's not safe cycling on that road. Same with Tamaki Drive. I'm really concerned that due to some political pressure there near the port entry there, that was taken away. Now the signs actually reduce the space for cycling, walking and wheelchairs, anything down to about half a metre or a metre, because the signs are in the way, and then you're literally pushing people out under large trucks. So it needs to be done by safety. We saw on Tamaki Drive a 91% increase in cycling. With that, we are going to get far fewer people on our buses and trains. The only other option, apart from getting in a car and driving to a car park that is not available in the city, is to cycle or walk to your workplace, as well as there's a whole lot more kids who have now found out that they can walk and cycle in their area. So I think we need to be focusing on safety of everyone. It's unprecedented times, as we keep saying, so there may be some disruption for other users of the road, but if we need to get people to work and people safely to school, then we're going to have to figure out how that all works. But based on safety, because the last thing we want is driving people into really unsafe circumstances. The other thing is, how we're going to manage the public transport system. Are we going to have more frequent buses throughout the day, or try and work with businesses to stagger their work times? I'm not sure if we all go back in level 2 how we can possibly be social distancing. We're going to have to be have staff out hopefully at major bus stops and things to try and see how we manage that. It's going to be very complicated, but I just think the app changes and the action of staff, to get all those cones out on the road in the middle of the night, and to, some other cities around the world are doing tens and tens and tens of kilometres, closing roads. We've done a great jump, but we're far behind most other major cities who are really taking this opportunity to make the roads safer. So thank you, but there's going to be a lot more nimble things that have to happen over the next couple of weeks and months. Thank you.
Thank you. Roger, quick reply on that.
Yes, Councillor Hills, thank you. I'll pick up your last point and then go back to your first point. The more frequent buses, we're obviously monitoring all of our schedules and have the ability to do something there to a limited point, given that our bus network will be back up to its full schedule. But what we are doing is looking at encouraging businesses to stagger their start times. We're looking at some other things at the moment around fares and when people come to work, and encouraging spreading that peak time out a little more widely so that people can start later. In terms of Tamaki Drive, one of the things we were able to do on Tamaki Drive was where we put the cones up along there, we did take away all the car parking in order to put those cones up, so that meant that we weren't infringing on the car lanes, if you like, on that seaside of Tamaki Drive. And up to your point at the ports of Auckland, yes, we did take away the western side limitations that we had put in there around safety as we went through that. We were doing that in conjunction with Ports of Auckland, and the feedback that we got from there and the Road Carriers Association too, we got positive feedback from them as a result of doing that.
Thank you, Roger. Councillor Shane Henderson.
Kia ora, nothing much from me. Just wanted to kind of back up Councillor Hills' point and say, look, you can't move for walking and cycling people around here in Te Atatū. So, Yeah, I suppose there's different parts of the city that are different, and the key is safety in all modes. So thank you.
Thank you. Tau Henare.
Nothing from me, Your Worship.
Thank you, Tau. Chris Fletcher. Are you on the line, Chris? I'll come back to Chris in case she's just popped away for a moment. Al Filipina.
All good.
All good, thank you. Chris Darby. Chris,
thanks, Mayor. Look, I've got you. Look, and just very briefly, Roger, look, I really commend AT for picking up the baton here and not waiting for the multiple reports before you made the move. I really commend AT for being agile, for being nimble, and recognising that people did need room. They needed safety. They needed an enjoyable environment to get out there and walk and cycle. And look, you're always going to have some sideline refereeing. Some whistles will be louder than others, but I'm really grateful, like others, I think, across Auckland, for the works that you have done and how you've responded and adjusted those works. And long may it last. I think it's a reflection on your management and your board for being proactive. Thank you.
Thank you, Councillor. Angela Dalton.
Thank you, Your Worship. Look, just a thank you to all of the presenters and for all of the hard work that's going on. Thank you.
Thank you very much. Councillor Linda Cooper.
Sorry. Hello. I want to thank AT. I think during this time I've done a lot of walking and cycling, and what I've noticed is people have become less aware of traffic around them because there has been less traffic, people walking on the road to avoid each other, etc. And so if there are, some of these projects that actually protect people from themselves because we've got out of the habit, that will help, but also just gives an opportunity. I mean, I think there's probably a balance here around what we do, taking into account what some people have said, but I want to be positive over this time. And seeing the buses and the drivers with their masks just constantly providing a service has been really extraordinary, and they've put themselves at risk, so I thank them as well. Just one thing is, what I think we hadn't realised was we had a huge traffic issues outside the transfer station in West Auckland. When it opened last week, it was chaos, and I want to thank you for your quick responses working with our Waste Solutions team, because we had trailers and trucks backed up for miles right back to the motorway in Lincoln Road, which is really difficult. And I think there's some of these things that will happen once we go into level 2 and level 1, where there'll be a huge push for people to get rid of rubbish, to do things they haven't been able to do. And I guess that'll create quite a call on AT and the police to manage those issues, because we haven't had this type of situation before. So thank you for being nimble and for keeping going. And I'm glad that you're one member of staff as well again. Thank you.
Thank you. Councillor Pipacoon.
Thank you, Mr. Mayor. I don't have any questions, but I would like to add my thanks to all the presenters and for the updates. Roger did talk about the need for agility, and I think that's applied across all of the emergency response, and particularly there's been a few comments around the emergency measures that have been rolled out, and it has required agility and doing things differently, because as we're very aware, and we're going to hear this a lot, that this is the new normal. There isn't just suddenly going to be returning to how things were pre-COVID. So I do thank Auckland Transport for doing that, what doesn't necessarily come naturally, which is moving very fast on prioritising safety for active transport. So it has been very welcome in many areas, and I do accept that often it is messy and it is imperfect, but we've got to try these measures because we are responding to a very unique crisis, and so I do just want to acknowledge that, and also the fact that we can keep improving and work on it to make it roll out as best as it can, and I'm very keen to support Auckland Transport doing that, and also looking at what's needed as we move to alert level 2, because again everyone thinks it's going to be just we're going to move into business as normal, but it's not going to be like that. We are going to have to do things differently, so keep at the agility, and thanks for that, and thank you to all the presenters. Kia ora.
Thank you, Councillor. Councillor Efeso Collins.
Nothing from me, thanks, Mayor.
Thank you, Councillor Kathy Casey.
I'm all good, Phil.
Thank you, Councillor Josephine Bartley.
Thank you, and thank you to the presenters. I did want to pick up on Auckland Transport, just to say good work on the hygiene, health and safety measures taken on the buses, because what we were getting in our reports, I wasn't hearing from my bus driver mates who were asking me things like, do I bring my own wipes to wipe the steering wheel? So, you know, they've been sending me photos of the hygiene packs they've received and the cleaning that's been taking place on the buses. So that is really, really good to see. So I'm glad Auckland Transport followed up New Zealand Bus on that. Thank you.
Thank you. And Deputy Mayor Bill Cashmore, if I can ask you to move the resolution, I'll second it, and if you need to speak as well.
Just to recognise that it's challenging times for all organisations and AT with moving the public around. Both in any formal mode is challenging, and it won't always be easy or straightforward, but I'd like to recognise their pragmatism and their fleetness of foot of getting these measures out and being willing to alter them where they need to be. Just a very quick one to Phil Wilson, and what's going to be the new norm as far as social distancing when we go back to operations and council and for our staff. Is there any work that what percentage, and we'll still have to probably work from home because of the corporate body stretch?
Thank you, Deputy Mayor. Yes, extensive work. Our planning is based on a percentage of staff coming back, and achieving that percentage. I think it was 30%, and under level 2 is being actively managed by managers. So instructions have already gone out about that, and we've got systems in place. Thank you.
Thank you, Mr. Mayor.
Sorry, I had my mic off. That's probably why nobody could hear me. Sharon, Stewart, if you'd like to second the motion moved by Deputy Mayor Cashmore, we'll put that motion to receive the report and to thank everybody, and in particular Roger Murphy for coming along from Auckland Transport. All those in favour, please say aye.
Aye.
Aye. Aye.
To the contrary, no. I declare that carried. I recommend we now take a break for lunch, and if we can come back by 1:30, please. Thank you very much.